So let's go into this session, which is focused on activity. At the end of this session, hopefully you will be able to identify conditions for which exercise and activity can help patients, and there are many of them. So most people with chronic diseases can benefit from improving their activity. We'll talk about how to engage patients in activity discussions, or when they engage you, if they have some of those conditions. Talk a little bit about some of the barriers that exist to this. Often there are income or resource barriers, and we'll talk a bit about that. Point to some resources, some of which are free, some of which cost a little bit, and a particular very developed effort that clinicians are encouraged to engage in, called the exercise prescription. And then we'll end by giving you an example of how to do some health coaching in patients who identify as activity as a key area. So the rationale and the whole point of this, as you all know, I think by now, is that the vast majority of healing does not come from the pills and the procedures that patients normally get in a medical encounter. Only about 15 to 20% of our population's health comes from that, because the rest of it comes from behavior and lifestyle factors and social and economic factors that either hinder or enhance the ability to engage in those areas. And so we're looking at inserting tools that allow you to address those other kinds of factors. Most of the tools that we have in delivery of healthcare are focused on that 15 to 20%. And what we're doing with the HOPE tools and the Integrative Health Visit is providing you with tools that can get at the rest of that 80%. What are those tools? You've seen them. They include the Personal Health Inventory, a 2-page questionnaire that patients can fill out online and that you have embedded in your current electronic record, Scout, and a set of questions for doing a note on those factors in healing called the HOPE Note, which stands for Healing-Oriented Practices and Environment. And the goal is to help patients understand and get engaged in self-care behaviors, equip them, and then support them in the process through their healing journey with health navigation and health coaching. So here's the Personal Health Inventory. You all have taken this and you've seen it. It is in your system. It focuses, first of all, on the question of what matters to the patient. Why do they want to be healthy? And this is the core motivating factor for their engagement in health behaviors. Then a little snapshot of how their health is right now, which can be a guide as to what to engage in, and then where they have readiness and interest to engage in healthy behaviors. The HOPE Note, the questions embedded in the HOPE Note, really cover 4 domains, which in these sessions we're going to be talking about in more detail: the physical body, the behavior and lifestyle, the social and emotional, and the spiritual and mental. The tool, the purpose of this is to explore what matters to the patient and begin to work with them to identify their own determinants of healing. In the case of chronic illness, for this session, we'll be talking about one aspect within behavior and lifestyle, which is called activity, sometimes called exercise, but exercise doesn't have to be the word that's used. It's really about movement in these areas. And so that question is part of the core aspect of the HOPE Note questions. Here's an example. Simply says, how is your activity level? And then in the PHI, they can also indicate if they have an interest in improving their activity level. These are embedded in the questions in Scout on activity. Here I've circled them. Are you able to move and do physical activities like walking, dancing, gardening, etc.? And how ready are you to make changes in those areas? If there is a need for that, if they say they're not able to engage in it and they're interested and would like to do that and have high readiness, then this becomes the focus of the visit for them to assist them to do that. Once those questions are identified, there are multiple other types of questions that you can begin to explore. And here's an example of them. I won't go over all of them, but you can begin to get some of the details about how active they are, the types of activities they engage in, whether their clinician, their physician, or their clinic has ever recommended they engage in more exercise for a health reason, how they would rate their current activity. Also, you can test their knowledge in this area and explore what some of their challenges and opportunities. We'll talk about this in a bit more detail when Alexi goes into the health coaching example. Okay, there's nothing better for engaging in these kinds of activities, any kind of health behavior activity, than engaging in it yourself. And so I'm going to ask Jen to call up a poll question here and ask you all to answer it. That question is, what do you do to keep active during the day? And there's the choice here of several different answers. Feel free to pick all of those areas. So, Jen, you want to go ahead and call that poll question up?
All right, it's up and people are starting to respond.
And I would encourage everyone to look at their own activity levels. And as we go through this session, identify for yourself where are areas that you can improve in your activity. And again, not necessarily only exercise. That's one aspect of it, but just the general activity in your daily life. When you do that, not only does it help you feel better, but it also helps you address some of the specific things that your patients will bring up in their attempt to do that. So it allows you to actually do what we're talking about in terms of supporting people in those areas. So patient education, patient education, patient education. Very important to do that. I'm going to give you some information right now that can help you to do that. But this slide is showing you 2 resources that you can pull from and actually use to share with your patients. One is a general healthy food, mind, lifestyle guide, in which is a description of various types of activities that people can engage in and a bit about the evidence that's useful for them in those areas. And it shows how the activity interacts with other areas also. There's another guide here, how much physical activity do you need, which begins to get them towards specifically identifying what they need in those areas. And we'll talk a little bit about what the guidelines are there and the types of activities in those areas. So sharing this information and then going over it with patients in a future visit or in that visit is helpful. Well, why is activity important and what does it do for healing? Well, the bottom line is twofold. Exercise and activity is a key determinant of the top 3 of 4 causes of death: cardiovascular disease, stroke, and cancer. And so if patients want to reduce their risk of death for the vast majority of chronic illnesses, then exercise can help do that. It is also a key component for functioning with chronic conditions and the same kind of conditions that their doctors are treating, such as diabetes, obesity, high blood pressure, and high blood fats. Your role is to help patients learn about the resources in these areas and then support them in improving activities in those areas. Exercise is probably one of the few true panaceas, meaning it can impact almost anything and does impact everything in a person's life, from their physical body to sleep and insomnia, to mood, connection and social activities, and even gaining insight about meaning and purpose can occur during increased activity. So it truly is one of those ubiquitous components. In the age of COVID, everyone is interested in knowing, what about the immune response? How do I strengthen my immune response? And if I get too much activity, is it going to impair it? Well, it is possible to suppress the immune response with too much activity. But if you find somebody who's doing that, you can have that conversation. It'll probably be 1 in 100. Very rarely does it do that. In fact, the vast majority of people who engage in activity, if they do it on a moderate and regular basis, they will maintain an enhanced immune response. And this has been well studied. What happens is that motion actually produces a stress on your body. It actually induces a physical pressure, if you will, on your body, and that creates an adaptogenic response. Your body then responds back with healing components, and that improves all kinds of components, including strength, resistance, resilience, and it also boosts the immune response in those areas. It's that repetitive stress and release component that improves the immune response. It has multiple other effects. Chronic pain and obesity are a key area that you'll see a lot with patients. This sort of makes sense, but people often don't realize this until they actually do it. Extra body mass has a chronic heavier load on bones and joints. And so people that have knee pain, ankle pain, hip pain, just by losing a few pounds, very often they will report improved pain in those joints. And it's kind of remarkable that happens. If you want to test this out, put on or carry around 10 to 20 pounds of weights in a backpack for a few days and see what it does to your joints when you remove it. It causes increased friction in the joints, which accelerates wear and tear. And then this results in improper posture, improper walking, and this type of thing, which can aggravate pain. People often ask, well, gee, if I overuse my joints, wouldn't that increase wear and tear? And remarkably, the research has shown that that does not happen. In fact, the very often opposite happens. The more your joints are used, the more they stimulate that adaptive reparative process that I referred to in relationship to the immune system in the past. And in fact, people find that using painful joints, as long as they're not hurting themselves, an acute pain, but just using them with gentle repetitive motion reduces pain and improves function. Quite the opposite than hurting it. So there's a story in my book where I show an individual who was on the placebo part of a clinical trial for their osteoarthritis, and they got remarkably better. And one of the reasons is because by taking the pill, they simply went out and moved more, and it was the movement that actually improved their pain. There are multiple other conditions in which exercise can help, and I'm not going to go through all of these, but just take a look at some of these things. This is 60 to 70% of the people that will walk into your office that have chronic illness of some type in these areas. When I ask many of my patients, well, what do they do for stress management? Very frequently, they will say, well, I exercise. So isn't that interesting? Here they have a psychological issue, a stress issue, and they use exercise to help them relax in those areas. So it has multiple effects on many things. In addition to the biologic and clinical and functional effects, there are multiple types of healthful activity. And here's where it's very important to emphasize that it is simply moving, and it doesn't have to be a lot of moving. You don't have to be a marathon runner. You don't have to go to the gym and do an intensive workout. There are multiple ways to improve endurance, strength, flexibility, and balance. And so there are a lot of things to pick from. I have many patients with chronic fibromyalgia, chronic pain syndrome, that say if they get out and they exercise too much, that they will get tired or they'll have an increase in their pain, and that does happen. But then there are still types of exercise that can help with that. For example, Tai Chi, very effective and probably the most effective treatment we currently have for fibromyalgia. And we're going to practice that in a little bit. I'll show you a few Tai Chi moves. So multiple smorgasbord of things to pick from. Finding things that they like and that they enjoy is something that you can help them identify through these components. So let's take a little bit of a stretch break right now and actually do an exercise. I'm going to stop sharing here, and I want everybody to stand up. Okay, I can't see you all, but you can stand up, and I want to teach you a very simple Tai Chi exercise. When I do virtual visits, very frequently I will insert a Tai Chi exercise, a standing Tai Chi exercise for them. It's a wonderful mind-body practice. Now you can't see my entire body here, but you can see enough of it. So everybody stand up. Just rub your hands together, sort of move about a little bit, just to kind of get things moving. And then let's just do some standing breathing Tai Chi. I'll show you some arm movements in a little bit. But let's start with just a simple set of breathing into the lower part of your belly. I'm going to hold my hands up here near my chest because my camera isn't showing all the way down. I can't get far enough back yet. But if you, what I'm looking for is for you to hold your hands. Here, let me see if I can get back a little bit farther. You can see this. Okay. Here, that's a little bit better. All right. So hold your hands down here around what's called the dantian, or a little bit below the belly button, between your belly button and the pelvis. And simply let your arms sort of hold as if you're holding a little energy ball there. Okay. And now let's take a deep breath into that ball. Let your belly come in. Bend your knees just a little bit. Sink down. And imagine that you're just sort of pivoting around that center point. Imagine for a minute that you're sort of being dangled like a marionette from a string, and you can go back and forth. Let your pelvic relax. You can tilt it a little bit back and forth, side to side, so you feel it very loose. And just take a deep breath into that area and hold your arms in this sort of primary position right there. Your knees should be a little bit bent, your pelvis relaxed, your eyes relaxed. And this is the basic Tai Chi stance. This creates toning, it improves deep breathing, and it improves balance. A number of Tai Chi exercises have been shown to reduce falls by improving balance in these areas. So now we're going to take a deep breath into that center part and exhale. Blow it out. Now take a deep breath again and inhale into the center part. Just imagine your body turning back and forth on that axis where you're dangling. Smile a little bit. Relax your eyes. And now we're going to take a deep breath, and when we do that, we're going to let our arms just be pulled up as if there were strings on the back of our wrists. Okay? Breathe in, come up, and then just let them come down. Breathing out. Coming back to the basic position. Breathe in to the center. Breathe out. Again, let's do it one more time. Breathe in, let the arms come out, and breathe out, let them come down. Now I'll show you one move in which we're going to step and turn to the side. This time you bring one arm up like this as you're breathing in. Turn to the side, let this hand just be out in front of you, and imagine you're pushing some energy to the side. Breathe out. Bring your other hand around, and now as you scan the horizon, imagine gathering energy from the entire world back, bringing it to the center, and as you exhale, bring it back to your center. You've just now gathered energy from the entire world. Now let's do it on the other side. Breathe up, push out, exhale. Gather the energy. Back to center. Okay, shake it out a little bit. We're going to do that move one more time, up and down, both of those moves. So shake it out, get your stance. Hold the energy in front of yourself. Imagine you're pivoting. Let your pelvis relax. Smile. Let your gaze relax. Hold the ball in front of you. Take a deep breath. Exhale. Now as you breathe in, let your arms come up. And exhale. Now breathe in again. Let them come up again. Just like a puppet, a marionette. Exhale. Now we'll gather everything from the world, turn to the side, press the energy away, gather from the horizon all the way around, across your shoulder and now down. Now to the other side, arms up, press the energy away. Inhale and gather, 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 gather from the entire world and back to your center. Thank you very much. That is a simple set of Tai Chi exercises, and you've learned the basic stance. And what I'll do sometimes is from visit to visit with my patients, I will then build on that with a very simple set of exercises. This is something that almost anybody can do. If they can't stand, they can do it sitting in a chair. Same type of thing, whether they're gathering the energy. Okay, so that's a stretch break. All right. So second poll question. Jen will share this one. The question is, how many times a week of moderate physical activity is currently recommended by the American Heart Association?
Thank you for leading us in that. Got lots of comments in there that felt good, getting up and moving around. I also want to share with you guys before we get started that in talking with some of the members of the team and with Beth, get a lot of very positive feedback about these sessions. So thank you so much for the time and energy y'all spend on getting these together. I know it takes a lot of work, and it's greatly appreciated. With that said, jumping into the national guidelines. So 150 minutes is the right answer. So happy you got that one, got that correct. So way to go. The guidelines, these are guidelines for adults. So 150 minutes of moderate intensity aerobic activity, and moderate defined here is a good fast-paced walk. So you're getting your heart rate up and you're feeling your breathing changing as you're walking. Or 75 minutes of vigorous activity. So that would include like a run for vigorous activity, row machine, some swimming, those types of things. The other recommendations here, in addition to, so not to replace, but in addition to that aerobic activity, would be some strengthening exercise, at least 2 days a week, that includes all major muscle groups. So as you're thinking about this, think about the conversations you're having with patients. You could certainly accomplish 1 and 2 together. So you could do intensity training that involves strengthening training that is actually also increasing your heart rate and giving you your aerobic benefit as well. So there are some ways, because you're going to, your main job will be objection handling and helping patients navigate those objections so that they can be successful at reaching their goals. helping them consolidate the amount of time they're spending into something that they feel is manageable. Might include actually blending those things together. And then other recommendations are just some basic things that most people can do. Just spend less time sitting. Doing what we just did helps us move us closer to that goal. So even light intensity types of activity is better than no activity, being sedentary. So get a good idea of where your patients are that you're speaking with their current day-to-day activity level. Those are some of those questions that Dr. Jonas shared with you earlier. And then the more exercise, and you may have folks, who are just trying to hit a mark. The more you do, the better. So you're not going to overdo it. Most of the patients you're working with are not going to be at risk of overtraining, so they can continue to do their exercise, increase the amount of exercise they're doing on a regular basis, and then you always want to make sure you're choosing safe exercises. On the next slide, what you'll see is some specifics around the population that's more likely the population that you'll be addressing. So a good deal of the patients where you're recommending increased activity level are your older patients who have some chronic conditions going on. So you want to make sure that you're taking those things into account. For older patients, balance is going to be extremely important. So think about this from a prevention standpoint. We want to prevent the likelihood that they may fall or may injure themselves by not having those fine motor skills in tune. As they become more sedentary or do less in the way of complex activities, then they may actually lose some of those fine motor skills more rapidly than the aging process would generally cause decline. The other thing is that you'll find a good number of adults just won't, or your patients won't be able to hit that 150-minute mark, maybe based on some chronic conditions they already have or some underlying heart disease, different things. So as you're engaging your patients in a exercise recommendation or some protocols, it may be important for you to reach out to your clinics and talk to the doctors, communicate with the doctors and find out, is there a reason that this patient may need some sort of, if they're not exercising at all, do they need some sort of pre-exercise evaluation with their doctor so that they can get engaged in some exercise and do it safely. So those are really big, I think, important things to just call out. Always be thinking about where are the safe, sort of the safety components of what a patient's doing. Some of the things I think I'll talk about it here on this slide that Dr. Jonas mentioned earlier around arthritis, for example. And again, I'm bringing this up from an ejection handling standpoint and how it relates to patients, the conversations you have with them and their chronic conditions. You may have patients, and I'm sure you probably have experienced this already, who will tell you that due to their arthritis or due to different issues that they are not able to exercise. And so I invite you to push that. As Dr. Jonas mentioned, exercise is actually one of the top things that you want to do for patients who have arthritis in order to at least stabilize their arthritis, if not improve their symptoms. Find out what your patients want. Why, if they're going to exercise, what are the goals they would like to have? Some of them may just say, I want to be able to get off the floor after playing with my grandkids, and I have a really hard time doing that, or I don't get on the floor to play with my grandkids because I'm afraid I can't get up. Or I want to be able to get out of a chair when I'm in public and not feel like if I sit down, I'm going to get stuck down. So they need some improved strength and range of motion. So try to really dig deep and understand what it is that might drive or motivate your patient into an exercise program. For some, it may just be the fear of aging or the resistance to the decline that may come with getting older, and they want to do whatever they can to fight aging, the process of aging. Or it could be, for some, they just want to maintain sexual health. So dig and ask those questions. Look at the list of things that exercise helps and prod your patients to really understanding what it is they're looking for. On the next slide, you're going to have to do some exploring with patients to really understand where they can go, what they can do. I would suggest starting with your practices. Find out what your practices offer. As you know, practices like ours, there are There are practices out there that actually have resources on site that can help patients and can actually, for a number of patients, get exercise covered and education around exercise covered through their insurance. There are some that don't, certainly, but many practices do have some awareness of resources that may be around the practice that patients can engage in, or they've built some sort of relationship with practices out there. When you're looking at, and we're going to talk about an exercise prescription here on the next slide, but when you're looking at different opportunities, try to build a bank of different resources that are available for practices that you are responsible for, that are local to those practices that can help patients. Then also, as Dr. Jonas mentioned, there are going to be some other resources that could be available online. So the exercise video, for example, with the Tai Chi video, great exercise for working on balance and helping with some stability for patients. And it gets them up, it gets them going, it keeps them from being sedentary. On the next slide, let's walk through quickly what an exercise prescription looks like. You may, for your patients, be able to complete an entire exercise prescription based on the time you have talking to patients and the ability you have to really dig deep and understand what it is that's driving their desire to exercise and what their capabilities are and what resources they have available. You should be able to complete an exercise prescription. Now, you're likely also going to want to check in with the practice and show that you've created this prescription and get buy-in from your docs. That is extremely valuable and continue to keep the services and support that you can provide practices front and center in the mind of the doc. It takes a little bit of time to build an exercise prescription for a patient. So being able to show that you've got that value, you can add that is fantastic. So what you're going to include are these bolded items on an exercise prescription. What type of exercise? So digging through, understanding what the patient can do, what they have access to would be important. The intensity of exercise. If they've not exercised at all, you're going to start slow and slowly build up over time. So maybe light exercise is what you're going to start with, a stroll or moderate, a little bit fast walk, or vigorous, go for a run if it's someone that's been exercising for a period of time. And then duration is just an example. So you're trying to hit that 150-minute mark as a minimum. If the patient can tolerate it, so 30 minutes 5 times a week, and then a target heart rate. Now, when you look at moderate and vigorous under the heart rate down there, so when you're calculating a target heart rate for a patient, it's typically 220 minus their age times a variable to try to hit them move them into a certain range. What I'll point out here is that 70% mark falls right between moderate and vigorous. If you're going to remember a number, remember that one. If you want to bring them down a little bit, then move it down a little towards the 50% area. If you think they can tolerate more, then you could move them up a little bit. I probably wouldn't push them much above 80, however. So 220 minus their age times 80 probably be the cutoff. 220 minus their age and very low could be their starting point if they've not exercised before. And then take the time to understand what kind of precautions that patient may have with regards to exercise so that you can steer exercise recommendations based on that. On the next slide, these are just some tips. And again, I won't go through all of these because I want to make sure we all get time for some a demonstration, some questions. The biggest thing I'll point out is look for things that could be a challenge for the patient as they start to engage in exercise, things that you think could either cause injury or impair their ability to successfully complete the exercise, or just some obvious obstacles potentially for them to get to exercise. On the next slide, some of those considerations might be financial. So you may have to do a little bit of digging to understand where that patient may be able to access exercise if they're choosing a location. Could be a nearby mall that they can walk in, there are many that have walking clubs. They can go at certain times and actually jump in with groups that like to walk. It could be parks that have some stations for exercise. It may be that they need to stay home and do body weight exercises and fashion exercise out of things that they have at home, cans of canned goods. Those types of things can be used as weights for resistance and can certainly get heart rates up. On the next slide, I think these are great, things to call out. Keep it simple. The more simple you keep it, the more likely they are to do it. You want to build it into their life, not just from what they normally do during the day, but what do you think they will do? What are the things they enjoy? Tap into those types of things, because people, they're going to be much more likely to do it if it's something they enjoy. If it's free, it's better for a lot of folks. Other folks need a little bit of a hook and to feel like they're getting a buy-in and some skin in the game in order for them to be successful. And there is a ton of technology out there, all different kinds of apps. Many are free that patients can use to get this process going.
Okay, thank you, Dr. Buller. That was fantastic. Great advice, great guidelines. And again, we'll provide all these slides to you after the session so that you can look into them in more detail, access some of the links, etc. Here's just a set of just a couple of examples that are out there and available both for adults and for children in terms of keeping their activities up. And there are, there's no shortage of equipment. And I've picked out some things here that are things that can be brought into your home or into the office if you're in an office. This is a picture up here of my office desk. I actually don't have a desk that I sit at in my office. I have a treadmill desk. You don't need a treadmill. You can just have a standing desk with a simple elevated stand for your laptop and your papers. And then other things like sitting balls, Fitbits, etc. There's a bike that goes underneath, and one can use it while you're working. A lot of times I'll be at my desk and I will start walking at about 1.5 miles. I'll be on the phone talking to somebody, and by the time I'm done in about an hour, I've taken 4,000 to 5,000 steps already, just from a phone call in those areas. So again, things to build into your daily life, stretch breaks, this type of thing. So finally, I would like to ask Lexi to take over and to give us an example. Lexi works with me. You've heard her before when we have talked about health coaching and how you follow up with patients and kind of move them along into their SMART goals. So here's an example that Lexi will talk about from a patient that I saw in which movement and exercise was one of their top priorities. Lexi?
After Dr. Jonas had his integrative health visit with this patient, Beth, he sent me a note letting me know she was interested in therapeutic yoga, walking for exercise, and in learning more about mind-body practices. So I sent her the therapeutic yoga pocket guide and the mind-body practices for pain tool, which are both available for free on Dr. Jonas's website. So I sent her those links and asked her to take a look at them before we talked. All right, during our first health coaching call, I asked Beth what she was interested in trying first, and she responded that she wanted to try yoga and getting more exercise by walking. She was interested in an in-person yoga instruction, and since Dr. Jonas had recommended she try therapeutic yoga for her back pain, we talked about that, and she also wanted to try some yoga at home on her own. So I gave her the contact information for a yoga instructor that we've worked with before, and she agreed that she would call and set up an appointment. She looked at her schedule while we were on the phone and agreed that she would try to call the next day to make that appointment with her. We also talked about how she could do yoga safely at home. She wanted to try streaming it on YouTube, but to narrow it down, we talked about her using some keywords when she searched for videos, looking for things like yoga for back pain or gentle yoga to make sure she didn't push it too hard. And then we talked about her walking goal, and I asked her how many days a week that she thought she would be able to do realistically, and she wanted to start with 3 days. And I asked which days. She thought she would try Monday, Wednesday, and Friday. And then during our conversation, I asked how confident she felt that she would be able to accomplish this goal. And she said she was at about an 8. So I asked what she could do to increase that to a 9 or a 10. And she thought that if she was to put a reminder on her calendar for each of those days, it would help her to remember, and that she would be more confident that she would do it. Next slide. So the week after this, we had an email, and this is an actual email that we got from the yoga practitioner. And you can read it here, but it was great to hear. And when we get feedback like this, it helps to remind me that these mind-body approaches are really helping our patients. I also wanted to mention that there was a question about the frequency of the health coaching. So we, as a standard, try to do it about every 2 weeks. Some patients are really self-motivated and don't need it that often. They might only need it once a month. Others might need it weekly for 2 or 3 months. We've had some patients that we've touched in with up to 6 months or even a year at times. So it really depends on your practice, your clinic, what your health coach to patient ratio is. So you'll have to think about that and talk about that within your clinic. And then think about with each patient how you can individualize it. Next slide. I wanted to just touch on a couple of health coaching techniques, especially listening to the conversation today about exercise. As a health coach, I'm not creating the plan for the patient. I'm helping the patient achieve their health goals and think about what behavior changes are that the doctor has recommended. So I'm acting in a different role than the doctor, guiding the patient to make SMART goals toward behavior change for the long term. And there was another question about what questions to ask the patients. And there is a PHP cheat sheet, and there's a link to that here, and we can send that out afterward. But that has a lot of helpful questions to ask patients during a health coaching call. And that wraps it up. Back to you.
Okay, thank you very much, Lexi. That's a great example. So that ends a formal part of our session here. I want to thank Dr. Bullard again. I'm going to stop sharing, and we do have a few minutes for questions, comments, etc. And if you don't mind, I'd like to first of all ask Dr. Bullard to talk a little bit about communicating back to the provider. What is it that is the most useful thing for you all to then make sure that you close the loop about when you have these discussions with patients back to their providers? And if you could talk a little bit about how that works in Catalyst.
Yeah, absolutely. I think you pointed out one thing earlier on around asking, has the provider before asked you to exercise? I think the answer for most of the patients that you'll be addressing as care team members is yes. That's happened at some point somewhere along the way. A provider's asked a patient to increase their exercise to help manage their condition. And if you look at that list of conditions, it's obvious why. The downside, of course, of the quick appointments that docs have with patients right now is they don't really get a lot of time to dig deep into exercise and understand why patients maybe aren't following those recommendations. I remember saying to patients, the same patient every 3 months, I need you to eat better, exercise and lose weight. I need you to eat better, exercise and lose weight, but not have the ability to dig down into obstacles. So the communication piece that's going to help those docs be more effective is you sharing back with them things that you've uncovered that could be obstacles for that patient to actually be successful at reaching those goals. And then communicating back to the docs, these are the things that I've tried to help the patient achieve from an exercise standpoint. The recommendations, the guidance, the support that I've been giving, like the support that Lexi pointed out, so that the doctor can then reinforce that with the patient when they come in. It is definitely a partnership. You're advocating for a care plan that the doctor may be putting in place, and to expect that reciprocal advocacy for the work that you're doing as an important part of the care team is one that really, I think, creates a winning recipe. So having that back and forth dialogue and exchange is super helpful. You'll notice Lexi, when she was talking about the treatment and the coaching she was doing, she tied it back to Dr. Jonas and the recommendations that he made, and made it very obvious they're part of a team working together. So doing that with a patient, communicating it on the chart, and making sure that the provider's aware of what's happening and can support you in your efforts, I think is the secret sauce there.